This week in health and science news, many medication ingredients or components that come from the EU could get caught in Trump's tariff wars. Medications like Rinvoq, Humira, Eliquis, Stelara, Ozempic could all end up costing consumers in the United States a lot more money because of the tariffs that Trump is putting into play. The WHO Director General posted this video behind me about the US cutting funding to the World Health Organization, which is going to lead to medication shortages, hospital closures, and a rise in diseases like malaria, HIV, and tuberculosis. The WHO is facing really tough budget cuts because of the US withdrawal, and it's going to reduce life-saving programs and emergency response around the world. The WHO is urging the US to reconsider, warning that millions of lives are at risk if it continues the way that it's going. The Department of Justice this week announced the removal of 11 guidelines for businesses seeking to comply with the Americans with Disabilities Act that were listed on their website. They said they were unnecessary and outdated guidance. One good thing to come out of the continuing resolution that was passed last week is that there will be extensions again for telehealth benefits for individuals that utilize Medicare. Those extensions will last another 6 months and will expire again on September 30th, 2025, when Congress is going to have to decide to either extend them or hopefully maybe we'll work on a bill in the interim that will be signed into law. Apparently, microplastics increase antibiotic resistance of E. coli and they aid in biofilm formation, a new study shows. Microplastic could be contributing to increased antimicrobial resistance and multi-drug resistance in foodborne pathogens like E. coli. Although the molecular composition of microplastics could help bacteria flourish, the exact mechanism is still not fully understood. Another interesting study to come out is that over-the-counter ibuprofen can speed up recovery from concussion by 20%. The study involved athletes and military cadets who had been diagnosed with concussions. Patients who took over-the-counter pain relievers were 20% more likely to return to unrestricted activities faster than those who didn't take pain relievers. That's it for this week. See you next week.